Hello everyone. So today's topic of discussion is Perl stain or Prussian blue reaction. So Perl stain, it is used to study the iron stores in bone marrow. In the bone marrow, iron is present in its ferric form as hemosiderin in the reticuloendothelial cells and free in the marrow. So by Perl stain or Prussian blue reaction, we assess iron stores in bone marrow that is present as hemosiderin in reticuloendothelial cell as well as it is present free in the marrow. So what are the reagents used in Perl stain? There are three important reagents. First is 2% potassium ferrocyanide, then N by 4 HCl and neutral red. 2% potassium ferrocyanide in distilled water that is free from iron. 2% potassium ferrocyanide, how it is prepared? 2 gram of salt, that is potassium ferrocyanide, is dissolved in 100 ml of distilled water. So we will get 2% potassium ferrocyanide. 200 ml of N by 4 HCl is used. N by 4 HCl, 4.5 ml of concentrated HCl. The concentrated HCl, it has 11.8 normality. So 4.5 ml of concentrated HCl is added to 195.5 ml of distilled water. Acid is added to the water and not the other way round. Then neutral red. 100 milligram of neutral red in 100 ml distilled water. So 1% neutral red is used. Coming to the procedure. Air dried bone marrow smear is fixed in methanol. So first step is fixation. Air dried bone marrow, they are fixed in methanol for 10 minutes. Then 1:1 mixture of reagents, potassium ferricyanide and N by 10 HCl is prepared and poured onto the slides for another 10 minutes. Then wash the slide thoroughly with water, tap water followed by distilled water. After that, smear is counter-stained with neutral red for 15 seconds. So air dried smears, they are fixed in methanol for 10 minutes. Then 1:1 mixture of potassium ferrocyanide and N by 4 HCl is prepared and poured onto the slide for 10 minutes. Then wash the slide and counter stain with neutral red for 15 seconds. Always use positive control slide. Positive reaction will give presence of blue granules. Now grading of iron stores on bone marrow aspiration. Iron stores, they are graded from 0 to 6. 0 or nil, no or nil iron granule seen is grade 0. Grade 1, when small granules are noted in reticulum cells under oil immersion. Grade 2 is few small granules are seen with low Perl lengths. Grade 3, numerous small granules in all marrow fragments. Grade 4 is large granules in small clumps. Grade 5, when dense large clumps are seen and very large deposits obscuring the marrow fragments is grade 6. This is the Perl stain grade 0. So This is the marrow fragment with no blue granules seen. So no granules are seen, it is grade 0. This is the Perl stain showing marrow fragment with few small granules on low power lens. So it is grade 2. Now you can see numerous granules. This is grade 3. This is the Perl stain of bone marrow aspirate smear. You can see granules forming large clumps. Large granules forming dense clumps. It is grade 5. This is also large dense clumps of iron granules. So grade 5. Showing increased iron stores. So interpretation of the results. Grade 0 means no granules are seen. It is in iron deficiency. But a minimum of 7 bone marrow particles must be available before concluded that hemosiderin is absent. So we must see 7 bone marrow particles without granules to label it as grade 0 or iron deficiency. Grade 1, 2 and 3, they are seen in normal iron stores. They indicate iron stores are normal. Grade 4 to 6, increased iron stores. So increased iron stores, they are seen in hemolytic anemias, anemia of chronic renal failure, multi-transfused patients, for example of thalassemia and aplastic anemia. Increased iron stores are also seen in megaloblastic anemia and sideroblastic anemia. So causes of increased iron store: megaloblastic anemia, sideroblastic anemia, hemolytic anemias, then anemia of chronic renal failure and multi-transfused patient, that is in thalassemia and aplastic anemia. Decreased iron stores or nil or grade 0, it is seen in iron deficiency anemia. Thank you.